Welcome back. Alcohol is the most commonly used addictive substance in the United States. And joining us this morning to discuss the effects of drinking, Gunderson Health System behavioral health therapist Casey Bablitch. Casey, thanks for being here this morning.
Thank you for having me.
Can you define alcoholism for us?
Alcoholism is a disease that consists of overuse and the inability to stop the use of alcohol.
How big of a problem is it? I mean, we see the statistics nationally. How big of a problem is it locally?
I think we live in a very, or in a culture that is really heavy in the binge drinking, and I think it's heavily promoted, so we tend to see quite a bit of problems with drinking here in the area.
What are some signs of alcoholism that people might not think? Maybe they just think it's social drinking. They just think, oh, you know, it's fine. I can handle it. But what are some signs that maybe people are actually struggling with alcoholism and they don't know that they are?
Drinking more than they intend is a big key. If somebody were to go out and say they're going to have 1 or 2 drinks and then end up having 8 to 10 drinks, staying out till bar time, driving under the influence, problems with finances, using at inappropriate times. Let's say like a family gathering where the intention is to stay sober, but then end up getting intoxicated. Also, medical or health concerns would be a big issue too.
So after it's been established that someone has maybe a problem with alcoholism, what are some of the steps that either they or family members can take next to help that problem, to help them to overcome that?
Well, I think it's important for family members to talk to the person, be open about what they're seeing, the problems that they're seeing, the concerns that they have. There's many treatment options available in the community. Talking to the healthcare provider is a good first step. Seeking out what services are available, getting in with behavioral health or therapist. If it's a student, talking to a student counselor. Those are all good options.
Yeah, something to keep an eye on while the weather gets warmer and we do more outdoor activities, shedding light on the effects of alcoholism. Casey, thanks for being here this morning. We appreciate you taking the time.
Thank you very much.